My name is Mary Velasquez, and I am a nurse practitioner and program manager at Memorial Medical Center in Modesto, California. I program manage the chest pain center and the STEMI receiving center. We are a heart attack center, and what I'd like to talk to you about today are the importance of understanding and knowing the early signs and symptoms of heart attack. Okay, so it's so important that to understand that over 800,000 people in the US every day can have a heart attack. And so on average, about 50% of these patients, they ignore the warning signs and they don't get the care that they need. So knowing that there are early signs and symptoms before you have a heart attack can help you get to the hospital faster or get to your doctor and maybe even try to prevent it from having a heart attack. So some of these signs you may have heard before, but what's interesting about early signs is they could happen days and months before or weeks. And they are the symptoms of having chest pressure, squeezing, a burning pain in your chest, even a feeling of fullness, a pain that can travel down one side of your arm or the other, jaw pain as well, excessive fatigue, anxiety, nausea, back pain, and shortness of breath. So these are signs and symptoms that can come and go, but you want to pay attention and seek help early. Now, 85% of heart damage occurs within the first few hours of an actual heart attack. So you want to know what these signs and symptoms are, because they can be very subtle, and you want to pay attention and get help immediately. Don't drive yourself. Call 911 because there's paramedics out there trained to do a 12-lead EKG in the field. They pre-notify us. The cardiac team will wait for you in the ER so we can help you and quickly take you, if needed, to a cath lab to open up that blocked vessel. Now, you also want to know about risk factors. What are the risk factors that you should be aware of? Well, we talked about chest pressure and burning and tightness and aching. But as I said, it can come and go in weeks and months and days before you actually have a heart attack. But you also have other risk factors to pay attention to. So family risk of cardiovascular disease, high blood pressure, you can control it. Also being overweight or obese, another thing we can control with diet and exercise, So a sedentary lifestyle and being more active, and totally stopping smoking if you smoke. Yeah, total get rid of any tobacco products. That's vaping, cigarettes, chewing tobacco. Metabolic diseases like diabetes and other illness can also lead to heart disease, cardiovascular heart disease. And for women, we have hormones that adds to issues for us, taking birth control, any history of preeclampsia, gestational diabetes, low birth weight babies. Those things tend to be more of a female problem. So that's where I want to kind of talk about the differences between men and women. So these heart attack symptoms can be different, okay? And it's important, it does matter because women are less likely to seek medical help. They're also more likely to die from a heart attack if they don't get the help they need. So men normally feel pain immediately, they get medical care. It's mostly on the left arm. These are just common. This is not everybody. And they're on the left side of the chest. But in women, these symptoms can appear on the right side of the body. Women also feel completely exhausted. We feel drained, dizzy, or very nauseous. And we also can feel upper back pain that can travel to our jaw. So women may think that it's the stomach flu or stomach pain, and they can have heart symptoms or an ulcer. So that's where I want to also lead into talking about atypical presentations, and the signs and symptoms can be different. So patients can often tell us that they didn't have any pain, or maybe not even any pressure in the chest. But so be aware of things like sharp pain, maybe feeling like there's a knife-like pain. Can come from maybe coughing or breathing, and pain that spreads above the jawbone into the your lower body. So, or difficulty breathing, labored breathing. So those can be atypical things. So you can save a life by calling 911. You can also do things like for someone who suddenly collapses, you can also perform hands-only CPR. You want to find the nearest AED, automated external defibrillator. They're often in business offices, in the mall, in the airports. And someone suddenly collapses, there's very easy directions. The machine tells you exactly what to do, and you put that on the person, and it can save a life. So a little bit about hands-only CPR. First, call 911, get help. Put your hands together on top of the chest of a patient. Just kind of clasp your hands together like this, right in the mid of their chest, and go as fast as you can. If you can count 1, 2, 3, 4, you want to go about 100 to 120 compressions per minute. So cardiac arrest comes from, an electrical malfunction in the heart. Irregular heartbeats can cause a sudden disruption in blood flow to the brain, to the lungs, and to other organs. So every year we unfortunately see more than 350,000 patients have out-of-hospital cardiac arrest. So hands-only CPR is a lifesaver. So thank you. If you have any questions, you certainly can reach out to any healthcare provider, your physicians, and stay safe, and call 911 in an emergency. Don't drive.